Morning, guys. Today is the day of my visit to the doctor. I just went ahead and took some Motrin, which is some ibuprofen. So let's get the day started. I am here at the IVF fertility clinic. My appointment is at 8:30. It is now 8:22. I'm actually waiting for my husband to pull up so I can go ahead and go in, because he will be assisting me in today's visit. So today I am supposed to be seeing the doctor to discuss my test results, and we will actually be doing the dye test. I will put the name of the dye test here, so you're able to see, like research it up, if you choose to do that. But I will be going in a couple of minutes to see the doctor, so let's go.
Thyroid level, which is TSH, is normal, okay? But you have antibodies to your thyroid. And when you have antibodies to your thyroid, studies have shown that you have higher risks of miscarriage and a lower chance of pregnancy, actually. So they're looking at right now giving low-dose thyroid to see if that would be of value. So I think that's the only thing we can do, actually, is to give you some low-dose thyroid medication, all right? You have a little bit of
how does that increase the thyroid?
It doesn't affect your antibodies. There really is so far no evidence that giving low-dose thyroid is going to counter that.
So, but how does the thyroid, with mine being high, like how does that occur?
Oh, genetic. I mean, there's no way to know why somebody has thyroid antibodies. It just happens in your body. These are circulating antibodies, and there's no understanding about why they develop. All right? They're circulating. I would have to do more research to determine. I mean, I'm trying to give you an analogy. I mean, you're born with antibodies. Why they sometimes develop and sometimes they don't, I would have no idea to be able to explain that.
Okay.
All right? Okay. So your hemoglobin is a little anemic. So you've had anemia before? Mm-hmm. Yep. All right. Are you on iron?
I take my prenatal vitamins, which have iron and
How
other
long
things.
have you been on those?
I've been off and on, but majority of this year. A little bit of last year as well.
Okay. Yeah, I would maybe take a little extra iron. Okay. Just one extra iron tablet, just to. I don't know if this is really due to iron deficiency. If it is, usually these numbers are low, but they're not. So I'd give a little bit of extra iron. You're immune. You have antibodies to rubella. You have antibodies to the chickenpox, which means you're immune to them. So you probably got the vaccine for rubella, and then maybe you were exposed to chickenpox when you were younger, or you had it, maybe.
Yeah, I had it.
Yeah. Okay. This blood test is called anti-Müllerian hormone. It's a measure of your ovarian age. The numbers of eggs that you have, you were born with, and as you get older, they become lower. Mm-hmm. So you are age-wise, again, let's see, 32, yes? Okay.
Yes.
All right. So 32, with 32, this is maybe a little bit on the lower side, but it is not predictive at all of chances to conceive or miscarriage or things like that. It just gives us an indication of how many eggs you would produce if we gave you fertility medication.
So how many eggs is it? Or
it doesn't give you a number of eggs. It's just a rough guide, essentially. Okay. levels below 0.4 are profoundly low.
Okay,
Right?
and what is mine?
It's 1.92. I'm only giving this as a baseline. It's not of any concern for your chances to conceive naturally.
Okay.
It's just a baseline, and if we were going to stimulate you, it'd be a little bit on the lower side in terms of numbers of eggs at 32, but that's not applicable to your situation. You have a good amount of vitamin D, and all that's good. So we know left tube is no longer, and we said that we had some fibroids, and it looked as though you have some distortion with your fibroid, pushing into where the uterus, this is the inside of the uterus right here. This is opened essentially for the depiction. And if the fibroid is pushing inside the uterine cavity where the embryo implants, that can increase the risk of miscarriage. So the purpose of the procedure that we were planning to do, which is the X-ray test for the tubes, would give us an indication of whether the uterus is showing a compression of the fibroid and whether the other tube is okay. If we do this and the tube is open, okay? If we do this and the tube is normal and open on the right side, the options are to give fertility medication with artificial insemination. That increases the number of eggs that you release from the ovary. Mm-hmm. And the artificial insemination provides your sperm, and we concentrate it in a small little volume and pass it through the cervix up into the uterus.
Is that the IUI?
IUI, exactly. Yeah, that's the pregnancy success rate is about anywhere from 10 to 20% per month. Okay, the most aggressive treatment option is in vitro fertilization.
When given the fertility medication, is it okay to try during that period of time?
You can definitely have intercourse, but there's no advantage to help you get pregnant unless you do IUI. Studies have shown that in patients who ovulate naturally, when they're having difficulty conceiving and need to go on fertility medication, there's no advantage to improve outcome unless you do the IUI.
After getting the process done today, I guess how soon can we move forward to the
following month?
The dye test.
Oh, I mean, as soon as you stop bleeding, we do the dye test.
Okay.
Yeah, it's all based on your period.
Okay.
Just to review, I was looking at my note that you had the uterine artery embolization for the fibroid, remember?
Right.
That can disrupt blood flow to the uterus, and that shares blood flow with the ovary.
Right.
So if you diminish it, you actually can have some ovarian aging, which you have.
Ovarian aging. Oh.
So that's the reason why your hormone level is a little bit low. That one we were just talking about.
For the thyroid being high, you mentioned about giving me something to lower it. Mm-hmm. How soon can I take?
You start taking today.
Today, okay.
You're not going to lower the antibodies. What we're doing is trying to counter the effects of the circulating antibodies, but we don't know there's no great medical evidence that it's going to be of value, but we offer that because that's all that we have right now.
And that's something that people
low dose natural thyroid.
Well, no, the high dose, that's typically something that someone is born with, you said, or is that something that I may have caused by like?
You didn't cause it. So I think some low dose thyroid medication would be appropriate. We did the prenatal labs. How are you all doing emotionally over the fertility?
I think we were happy.
Yeah.
Because
we've been a lot to go through.
Yeah, we've been talking about it after the miscarriage. We kind of first started to discuss it, and then after the ectopic pregnancy, we were kind of considering it even more because we weren't sure, weren't getting answers as to what was going on with my body. Right. So I was glad for the test because it kind of let me know what I need to keep focusing on, which my blood test for like the anemic, that's gotten better because it was like a 6 and a 7.
Your hemoglobin was a 6 or 7?
Mm-hmm. It was really low.
Oh, with the fibroid.
Okay, so you all did just hear, you know, my whole history of my thyroids and blood test results. I did go ahead and get a genetic test done, in which I wasn't expecting to do that, so I didn't pull up my camera because it was just like a spare of the moment. I do have now my HSG scheduled for tomorrow, so I will be getting that done. And you have to get the SHG scheduled between your cycle day of 6 and 12, and I will be on my cycle day of 7 tomorrow. Today obviously is my 6th day. Yeah, so kind of discouraged, but overall not. Like, I know that once I get my blood tests up, I'll be fine. He did give me some thyroid medicine to lower my thyroid. It's not a guarantee that he said that it will increase my chances of getting pregnant. So thyroid, fibroid, and possibly, me being anemic are 3 things that could be the cause of, of a miscarriage or not being able to get pregnant. But he also let me know, if you heard, I don't know if it picked up or not, but the fibroid embolization, he informed me that can cause the blood flow to the uterus to be lower, which can also cause one to not be able to get pregnant. So I didn't know that at all, and I kind of wish I would have known that going in. But I feel like definitely I'm going to be okay, because I know that the Lord himself has promised me a little girl. Good morning, you all. It is 10:47 and it is Wednesday, and I'm headed to pick up my medicine, which is an antibiotic for the procedure that I'm about to have. But I'm going to pick up the antibiotics, and then I'm headed to get the procedure done. I'm going to see if I can bring you all in. If not, then we'll just have to talk about it later. Okay, so I just pulled up my appointment. It's at 11:30. I think I mentioned that. It's 11:13 right now. I'm about to go ahead, put some eyebrows on. Y'all know I don't have no eyebrows. Wham. Anywho, I did want to mention, I'll do a video of the things that you should know before getting this procedure, because I've been watching videos on it and I just want to give my spin and take on it. So first thing, I just want to make sure that I am like physically ready to do this, because I don't know if it's like painful or not, or some people have said discomfort they felt with the procedure. So I am nervous. I brought me some socks, and I bought some comfortable clothes, and I also bought a pad. I should have probably bought a panty liner. I thought I grabbed one, but I think I forgot to put it in my bag. But I've heard that one can bleed. So yeah, I'm gonna make sure that I am ready as much as possible. So I am going in. I'm gonna be early. I have to stop the process. At this point of time, I feel like I have to stop because I have to take care of my fibroid. I used to have 2 fibroids. The other fibroid is really small, so he's not really concerned about it. But the other fibroid it went down 2 inches. It was 6 inches when I got the fibroid embolization. However, now it's 4 inches. But this is my uterus, and then this is the fibroid pushing against the uterus, which makes it difficult to conceive, and if one conceives, makes it difficult to hold the baby. I'm really trying not to cry. I've tried to change my diet around to get the fibroid smaller, so going the whole natural way, and I'm not sure if that had, sorry y'all, my ear's itching and I don't like digging in there. But that could have played a part in it, being smaller in size to the 2 inches. It could have not. I don't know. I really just want it out of my body, out of my life. There's a possibility that it can come back. It does grow in size when one gets pregnant. So yeah, the dye test did show that my right fallopian tube was good. There was no blockage, which is good. The left one, obviously, as we know, the ectopic pregnancy at birth, so I no longer have a left tube. So we're even saying that. But the fibroid was just concerning for him as well as for me. I would say like maybe once or twice a year I have excruciating pain with the fibroid. I'm not claiming it as mine. I don't want it. But when it comes, it's there, and I've been nervous about getting surgery just because, one, I've already had surgery and I kind of just wish they would have removed it then. But then two, there's a possibility of it coming back. So it's like you go through surgery, one goes through surgery and it comes back. I mean, well, that sucks. My hair feels tight. Sorry. So yeah, very discouraging hearing the news. But at the same time, you know, God is good and He has a plan. I am going to move forward with talking to my OBG. So that he can see, you know, options about the surgery and possible dates. I want to talk to my mom, talk to God as to what He's wanted me to do. Because I don't want to just jump into the surgery, but at the same time, it's just been causing me so much pain over the years. It just won't go away. So yeah, that's that. So the whole fertility process will stop. I mean, I can go ahead and get the IUIs like $1,000, you know, something dollars each time, but with me, because I can get pregnant, it's just carrying that baby has been, you know, an issue. So yeah, I don't really know what else to say. That's pretty much it. I couldn't record it when I got the process done. Which I'll put the name of it here. It was a little bit painful because he had to move my uterus around because of the fibroid, which you could tell, like the blood vessels in the fibroid. Oh, so annoying. So he had to kind of push the probe more into my cervix and kind of move the uterus around, because I had to get like 3 different types of fluid. Well, not 3 different types. He had to do it 3 different times, filling my uterus up with fluid, because that fibroid was just in a position that it made it difficult to get to the right side of my fallopian tube for him to see if there was a flow. If the fluid spills out, then obviously that lets one know that they can't get pregnant possibly in that tube, because the baby is falling out of whatever hole or slit or whatever's going on. I'm hoping I'm making sense. I'm really trying to keep from crying. I'm gonna call my husband, but my life, my journey, it is truly a journey. So if you have any advice, experience that you want to share, please definitely comment down below in the comment section. Subscribe to my channel, Mrs.Cowart Journey, because it's truly a journey where we talk about my hair, my pregnancy loss, trying to conceive, and whatever else of this life of a journey that I am on. We share our experiences without judgment, and we are open and honest about, you know, our life. And that's just who I am, wrapped up. Just gave you gave you my life story. That's it. Make sure you subscribe, like this video, turn on your notification, and I will see you in another video, dolls. Bye.